Okay, hello, my name is Mimi Sutherland. I'm an RN and I have a master's in public health. And I've been doing this for several years, trying to help people with Medicare. For many people, it's a very overwhelming subject. There's just so much to know, and then just when you think you know it, they make changes. So this morning, I'm going to try and take the book that the government publishes, CMS, which is Centers for Medicare and Medicaid, put out a book called Medicare and You. I'm sure you've seen it. It's about this thick. And so my job this morning is to condense that information and to try and highlight the things that you need to know so that you can be comfortable with Medicare. And I call it Medicare 101. First of all, what is Medicare? Medicare is health insurance for the following people: for people that are age 65 and over, for people that are under 65 with certain disabilities, and also people with end-stage renal disease. When do you sign up for Medicare? That's always a question that people ask. Well, there is an open enrollment period for Medicare. It's a 7-month period, the 3 months before your birthday, the month of your birthday, and 3 months after your birthday. And some people delay signing up, or they don't realize they need to sign up, and that can cause problems. You can incur a penalty and have other problems. So it's a good idea to remember about the time that you're turning 65 to be sure that you do sign up for Medicare. Okay, I always have the question, how do you sign up for Medicare? First thing you do is Social Security, which is kind of confusing because that's how you sign up for Medicare, is by calling Social Security. And that number is 1-800-772-1213. And you can call that number anytime during your open enrollment period. Now, some people automatically get their Medicare cards. Those people that are receiving Social Security will automatically get their Medicare cards in the mail. And if, for instance, you are on a group and you don't want to sign up for Part B, you can refuse Part B at that time and then pick it up later when you leave your group coverage. If you delay in signing up for some reason or another, you can be penalized, so it's very important to remember these dates for Medicare. In fact, if you are late, then there is a penalty, and you would have to sign up late between January 1st and March 31st of the year, and then you would start your benefits in July of that same year. And for those of you who would like to download this information, the whole presentation will be available. At the top of the screen, there's like a little paper clip. If you click on that, you can download this information because there are a lot of important phone numbers and contact information that you should have. There are basically 4 parts to Medicare. The first part is Medicare A, which is your hospital. Medicare B is your medical. Medicare C are your Medicare Advantage plans. This is the one a lot of people didn't realize there was Medicare C, but there is a Medicare C. And then the new plans are the Medicare Part D plans. And those are your prescription drug plans. Part A, the hospital, also covers inpatient hospital, skilled nursing, and hospice. There is no premium for Part A. You get that automatically if you've worked 40 quarters in your lifetime. Or if you're a spouse and perhaps you haven't worked, then you can get it through your spouse that has been working. Also, if you are maybe new to this country and you didn't work 40 quarters, then you can buy Medicare A. And for people that have not earned it, then they can purchase it for $461 a month in 2010. And that amount does go up every year. It also covers coverage in a hospital. It covers semi-private rooms, so if you want a private room, then you would be charged a little extra for that. It does cover home care for medically necessary, part-time, and intermittent skilled care at home. It covers some physical therapy, speech therapy, occupational therapy, and some home health aid services at home. Medicare Part B is your doctor, your medical portion. It covers medically necessary expenses, labs, x-rays, therapy, speech therapy, occupational physical therapy, outpatient surgery, and some Part B drugs. You must pay a premium for this coverage, and there is a base premium that you pay, and now in 2010 the premium was $110.50. For people that had Medicare prior to that, some of them were paying just $96.40 for that.